I would just say there are so many reasons to be hopeful about the future.
I see thousands of people, right, working to improve donation and transplantation.
The transplant system in America is evolving, and you deserve to know what that means. Today, we're unpacking the Securing the U.S. Organ Procurement and Transplantation Network, or OPTN Act, with experts Miriam Godwin and Jullie Hoggan. Learn why this legislation was introduced, how it could help improve the organ transplant system, and what it means for people waiting for or living with a kidney transplant. Hello all, and welcome back to another episode of Hot Topics in Kidney Health. I am your host, Marlena Chesner, NKF Senior Digital Content Development Manager, here to talk about the transplant system with two truly incredible guests. We have Miriam Godwin, NKF's Vice President of Health Policy and Clinical Outcomes, and Jullie Hoggan, Transplant Director for Patients.app, a technology company and a member of the OPTN Patient Affairs Committee. So welcome both so much for joining today. So before we dive into the policy, I would love if you could both introduce yourselves and share why this issue is so meaningful to you. Miriam, would you like to kick us off?
Sure. Well, thanks so much for having us. It's such an honor and a pleasure to be on this podcast. So my name is Miriam. I'm the Vice President of Health Policy here at the National Kidney Foundation. And I'm also a living kidney donor. So I donated my kidney during the pandemic in 2021. And that experience, in addition to my work here at NKF, has made me really passionate about ensuring that donation is always safe for other donor patients, whether they're living donors like me, or they become deceased donors, or they enter into the donation system and ultimately don't end up donating their organs. I'm also a policy nerd. So I studied public policy in school. And so I also care a lot about policy implementation. So the difference between a law and how the law actually interacts with the lives of the people that we serve, or policy implementation. So the policy that we're going to be talking about today, as Marlena said, is the modernization of the Organ Procurement and Transplant Network. It sounds really technical, and it is technical, but at the end of the day, it's fundamentally about giving the government and the Organ Procurement and Transplant Network and other groups in transplant better tools and better data to serve people better. And that's why this issue and the ongoing implementation of the OPTN modernization is so important to NKF. It's also why I'm really passionate about it.
First off, thank you so much for giving the gift of life. It's always so incredible to get to talk with kidney donors. And also thank you for being here to discuss the policy aspect of this. I, for one, am really excited to learn more about it. Jullie, would you like to introduce yourself?
Sure. So I wear a few different hats. I am, as you mentioned, the Transplant Director at Patients.app, which is a technology company where we create efficiency in the transplant referral and evaluation process. I also lead patient education at Kidney Solutions, which is a nonprofit where we mentor and support people who have later stage kidney disease and support their living kidney donors. And I'm also the founder of Square Knot Health, where I worked alongside a wonderful transplant nephrologist, helping patients and their potential donors through the transplant and donation process using patient navigators. So I'm also a transplant recipient myself, and I received a kidney transplant in 2020. And going through that process as someone who didn't know anything about transplant really helped me understand how difficult it can be for patients to navigate this process and understand the options. And while I love helping people learn one-on-one about the system and how to get listed and how to find a donor, most people don't have someone doing that with them. And so that is what made me really want to get involved in some of the bigger policy and systems issues like what we'll be talking about today. I do serve on the OPTN Patient Affairs Committee and the Patient Safety Officer Work Group. And I'm also working in public policy with Miriam at the National Kidney Foundation at TRIO, which is Transplant Recipients International. And I'm on a number of other, national patient groups and advisory groups for patients about, focusing on living donation and transplantation and the use of AI in transplant. So for me, modernization matters because patients and donors need accurate information at the right time to make good decisions and participate in their care. So they really need to understand where they are in the process and what their options are. And most importantly, patients And when I say patients, I also include families and donors and the donor families. And the public all need to trust this system and trust that it's working safely and fairly because the entire system depends on that trust. And so this modernization process, to update and improve the system is so important for all of us who are within the system.
Absolutely. And congratulations on your transplant. That's always so exciting to hear. And I love that we have both sides of the conversation really
Yes,
represented today.
I love it.
All right, so let's get into it. Miriam, I'd love if you could kind of set some groundwork for us. What exactly is the OPTN Act? We talked a little bit about why it's
Yeah.
important, but why also is it so important today?
Yes, no, we will totally start at the beginning and walk everybody through what this is. But I definitely first just have to shout out Jullie, who is such an incredibly valuable member of NKF's Public Policy Committee and is such a North Star for me on all kinds of different transplant policy issues. One of our leading experts in this space, and we're so grateful to get to work with her. So thank you, Jullie, for all that you do. Okay, so let's talk about what exactly the modernization legislation was. So, from a historical standpoint, it was signed in 2022 by former President Biden, and he signed the bill into law known as the Securing the U.S. Organ Procurement and Transplant Network Act. So, one of the themes of learning about the modernization is going to be the government using the most complex possible terms to describe simple things. So, just know that going forward. The OPTN is a membership organization inside the US government, which is a little bit of a complicated arrangement, but that is how it has been set up over the past 40 odd years. The OPTN is made up of every transplant center, organ procurement organization, histocompatibility lab, and also other organizations like NKF. So there are almost 450 total members of the OPTN. So you also need to know, just by way of background, that a huge amount of the work of the federal government is actually done by contractors. So when you look at the entire federal government, there are actually far more government contractors that do the work of our country than there are actual federal employees. So that means that one really important thing that the US government does is it buys services from contractors. And that is called procurement. And so that's another example of using a really technical term to describe a very simple thing, which is, trying to go out and buy services and buy expertise so that all these different parts of the government that we rely on are able to function. So, for the past several decades, there has been only one contractor that has done all the work of the OPTN, and that is an organization called the United Network for Organ Sharing, or UNOS. And what the new law did a couple of different things, but one of the big things was to direct the government to break that single contract up into multiple contracts. So, for example, you'd have one contractor that's going to run safety, and you'd have another contractor that's going to run policy, and you'd have another contractor that's going to run IT. So, to try to make this real, I would say you can sort of think about a really complex set of operations and to ask yourself if it's realistic to have one organization do everything that the Organ Procurement and Transplant Network needs. And you might decide, as Congress decided, that it might be better to have more contractors so that you can get the best service for every function of the OPTN instead of asking just one organization to try and do everything. So, what the law really does is it allows the government to acknowledge that fact and to buy the best in class services that it can for all the different parts of the OPTN. The law also has other features, like it created an independent board for the OPTN. And that was really important because it reduced the perception that there could be a conflict of interest between the contractor that runs the OPTN and the actual members of the OPTN. And that goes to Jullie's point about trust. The whole system is built on trust. And when we're dealing with the issue of who gets an organ when, and the world of like thorny ethical issues that we deal with in donation and transplant. It's really important to avoid perceptions of conflict of interest. And finally, again, since I am a nerd about public policy, one of the things that I personally think is super important is getting better data that can inform safety and transparency and accountability to patients. And that seems like a small part of the modernization, but it's actually really important to understanding how our system works and making sure that our system is accountable for patients. So I'm just going to give one quick example, which is if you look at a system from like a bird's eye view and we look at everyone who got a kidney, the system can look really good from that angle because in this country, we have achieved extraordinary 1-year outcomes for the survival of the patient and the survival of the kidney. And that's something we should be really, really proud of. But if you only look at that outcome, you only measured the people that the system works for. So, what about the patient that called the transplant center and they never got a call back? Or what about the patient who went through the whole pre transplant process and they weren't listed? Or the patient who was inactivated on the list and they didn't know? All of those patients matter too. And when we don't collect data on them, they're invisible to us from a systems perspective. And that's why I'm so passionate about the data piece, because I want to focus on where the system works, but I also want to focus on where the system doesn't work so that we can try to close those gaps for patients.
Yeah, and I'd love to dig a little bit more into those gaps or challenges. Julie, can you get a little bit more in depth into that for those who have kidney disease and those waiting for a kidney transplant?
Sure. So when patients are thinking about this, a lot of what they don't understand is just how the system works. And they know the wait times are long. They're not sure how to find a living donor or if they're willing or want to do that. They hear that organs are being recovered, but maybe not used. And then they're unsure where in the process they are, or, how long they're expected to wait for an organ. So from their perspective, they often feel lost and maybe like a step or two behind. Um, and Miriam mentioned, patients who either don't get listed and, there's other patients who think they're listed and they're not. I've had patients come to me in both of those situations. And when they eventually figure out that they aren't where they thought they were, they're upset or angry, which is understandable, right? And so some of these issues have been talked about for quite some time at the OPTN and in patient communities and community organizations. Patients want to know their status on the wait list. They want to know if they're listed and they're active. And they feel this is a really urgent issue and it impacts their care day to day. But the system has been traditionally kind of slow to respond to this. And so reimagining how these systems, that make policy or that make the system work better, those things can directly improve patient care and shore up their trust in the system. Modernization, while these important, changing contracts and sort of restructuring and reorganizing things are important, there's a real opportunity to build a system that listens to the people that it serves and brings together people from all across the system and brings the resources that are out there to really help patients and make things work day to day in a way that can be implemented in a reasonable amount of time. And so that urgency that patients feel can be felt by the patients, that it's being matched by the system. And I think that's such a critical part of building and maintaining the trust for patients and the public.
Absolutely. And you mentioned trust again, which is a really good theme of today's episode. And I imagine that some of the experiences that people have faced with the transplant system may erode trust. So, Miriam, I'm curious, do you think that all this work is going to ultimately help improve that?
Yeah, I really do. And I love the way that Julie framed it as a system that matches the urgency that patients feel. I think that when we talk about trust, I think it is so much about having a system that is responsive. And so I can just give you one quick example. We, from an NKF policy and advocacy standpoint, have been really, really focused on like, what are the very tactical, real things that are happening in the modernization that are going to make patients' lives better. And I'm just going to give you one example. So, earlier, I had talked about how it can be sort of challenging for any organization to do like everything that the OPTN needs. And one of the ways that the government had approached trying to figure out what could be improved was to do these projects called discovery assessments, where they kind of looked at the different functions of the OPTN and they tried to figure out like, okay, what is working well, what could be working better. And one of those projects was to actually look at how the OPTN does safety monitoring and oversight. So it found all kinds of ways that, safety issues were sort of falling through the cracks, things like having manual reporting or having a really narrow definition of what constitutes a safety violation. And I can imagine that if I'm a donor or a patient and I make a complaint, right? I feel in some way that the system hasn't served me or that something unsafe has happened. It doesn't make me feel good if I go to report that into a system that's a black box. It's not responsive to me. I don't feel like there's a feedback loop. I think little things like that can really erode people's faith that the system is working for them. I think we've all had that experience of like trying to complain about something and kind of wondering like, is anybody listening? Like, is anything going to happen here or am I just wasting my time? So, as part of these discovery assessments, we also had to grapple with this fact that, safety oversight was really relying on OPTN volunteers and like sometimes even transplant surgeons. I work with a lot of transplant surgeons. I know Jullie knows a lot of transplant surgeons. Like these are very, very, very busy, important physicians in our system. They're very sleep deprived. They're transplanting organs like at all hours of the day and night. And we had to ask the question of like, does it really make sense for these really busy professionals to be the ones doing kind of peer reviews of safety issues? Or should they be postponing surgeries or trying to get surgical coverage in order to go on site and do a review of a transplant center or an OPO? So, things like that are real. They offer us a real concrete way to improve the system and to make the system safer. And I think that's the kind of tactical, grounded policy improvement that could really improve someone's experience of donation and transplant and could really make them feel heard and like the system is responding to them and is really putting them at the center. There are a lot of examples of that, but I think that's one that really brought it home to me that the work we're doing here could make a difference to somebody who picked up the phone and called.
Absolutely. I know a lot of people with kidney failure feel like they've lost a lot of control. So I imagine how then frustrating that would be to go into a system that doesn't give you the control. And I love how it sounds like that this act is putting that back into the patient's hand. So, Julie, we've talked a lot about some of the systems, and do you think it'll increase transparency overall? How do you think that it will increase that? And will that help patients make more informed decisions in the future?
Yeah, I do. And I hope so. And one thing I hear from patients all the time is I wish I had known that sooner, whatever the thing is. And, one of the things that happens with patients is, they go through all this transplant education and all the things that are the transplant centers are required to tell them. And then they may join a support group or meet somebody out in the community who's a transplant, either a recipient or who's going through the process as well. And they may learn things there that they haven't yet learned. And they could be 2 or 3 or 5 years into this. And they may find that there was a transplant center that could have better served them if somebody had told them about a program that their center didn't offer. An example of that would be maybe a paired exchange program or a program for patients who are highly sensitized, which just means they have high antibodies and they're very difficult to match. And so across the country, not all programs are the same. And so when I think about transparency, getting that information to patients, even if that means saying, well, there's another transplant center down the road that could actually help you better than we could. It's hard as transplant centers because everybody wants to do all the transplants, but it's something that's so critical that it could literally save somebody's life. Because if they're waiting on a list and the thing that, they need is somewhere else, they could die waiting on the list. And so this is not, you know, it's not theoretical. It's really important for patients to, understand these things. So another, the paired exchange is a really good example in that, when we don't have that program, what that means in practice is that, if I get listed at a transplant center, I just get referred by my doctor to the center that's, in the community. And I have a bunch of willing donors, but they don't match my blood group, my blood type. They won't be further tested beyond that. And most patients think, well, if my donors come and they're evaluated, one of them could be my donor. And this is not true at every center if their blood group doesn't match. At other centers, they can put them into an exchange and, the patient can receive a kidney from someone else, and their donor donates to someone else, and everybody gets a kidney. In fact, two people get kidneys. This is just if a patient thinks that this is part of their center's services, or they've never heard of this and they don't know that they could go somewhere else to get this, it can make a big difference in their care. So when patients learn about these things later, it can erode that trust. And, you know, they may not feel as trusting in their own team, which is a problem going forward because they have to work with this transplant center for the life of their kidney, the life of their transplant, and that can be a really long time. So it's important that patients understand that the system is committed to telling them the truth and keeping them informed and identifying problems and then learning from them. And as Miriam said, having a system that reports back to you and closes that loop, that is what builds trust, kind of across all of transplant, and I mean all of healthcare really. So patients can really see that things are happening and problems are being taken care of.
And on that thread, what improvements will patients notice over the next several years?
Yeah, so it's interesting. I think with modernization, a lot of things are happening behind the scenes, right? The changes with the vendors that are providing all these different services. Patients probably shouldn't notice most of that, and there shouldn't be any disruption to their care. One very cool program, though, that we will see this year is HRSA has funded the Public Education Living Organ Donor Reimbursement Program. And that's kind of a mouthful. But what that means is there's a program called NELDAC, which is the National Living Donor Assistance Center. And that's also funded by HRSA. And so what this does is it helps to be sure that patients who might have a financial barrier, a donor that wants to donate, if they have a financial barrier to donating, that they can have their expenses reimbursed so that there isn't a cost or there's a very low cost, hopefully no cost for them to donate. And the education program that HRSA is funded is going to roll out later this year. And the focus is really to help people understand more about living kidney and liver donation and reaching into communities that are often overlooked in healthcare outreach. So we're going to see, health literate educational information going out into communities that, may not have heard about living donation. And hopefully the goal is really to get more people to apply for this program. And if they need the funding to help them become a living donor and be sure that these financial barriers are not what's in the way. So this is a very cool program that, HRSA is funding sort of both the education and the reimbursement for donors. And generally, what I hope is that patients notice over time is, and if we're doing a good job of this, their journey will feel less like a mystery. That black box that Miriam talked about. I mean, patients often feel that way. And I hope that the system gets better at identifying where people are getting stuck and falling out of the process. I hope that there will be data, more data collected on that kind of information about who's falling out and when they're falling out and why, and then developing solutions to address those problems. I do think that patients shouldn't have to become experts in transplantation to successfully navigate this process. And, I do think that, modernization has not been an easy process. I have to say that it's complicated and it's taken some time. And, I've experienced firsthand that it's been disruptive, right? The committees that have been working have had to be on pause, because they've been transitioning from one vendor to another. And these are the places where we all get together to solve problems. And it's been frustrating. But the good news is that the contract has been awarded. to actually support the committees now. And so I'm really hopeful that we'll be getting back to work and, continuing to build a stronger system.
That is literally also exciting. I cannot wait for the living donor program to roll out and we can start getting people involved in that, because I know it's a barrier.
Yeah, totally.
Well, and it is already in, the program is NELDAC already is out there and working, but getting this in more places and it's kind of shifting the way that this program works. And so I'm excited too. And I hope that we will definitely see more people applying and making sure they get reimbursed for those expenses.
And continuing looking forward, Miriam, from your perspective, what modernization milestones are you most hopeful patients will see within the next 5 years? And how can people listening continue to stay informed about these updates?
Yeah, well, I would totally echo Julie's point that a lot of these changes are happening at the system level and at the level of government procurements and buying services and changing vendors. And so when it comes to that level of change, patients shouldn't notice anything. But I would also agree with Julie that I hope over time we're going to get to a system that is more transparent and easier to navigate. And one thing I will say is that some of this work is happening through the modernization. So through that really concrete implementation at the Department of Health and Human Services of the Securing the U.S. OPTN Act signed by former President Biden. But there are also policies that we are trying to advocate for, outside of that modernization that I think are part of the big goal of making the system more transparent. And one of those, there are many, many things that we advocate for, but broadly speaking, it all has to do with transparency and giving patients more information if they will find more information activating and empowering. So one example, we've been out there talking about how important it is for patients to be able to get some information about organ offers that are made on their behalf but declined by the transplant center. Sometimes patients don't know about that. They can have 10 or even more offers made to them, and they're not getting any updates. And for someone that's enduring one of the hardest things in medicine, which is sitting on the kidney transplant wait list, that seems to me really, really, really unfair to take that agency away from patients. But also, as Julie mentioned, sharing with patients when their status on the waitlist changes. I would agree that I talk to patients too often who say, I thought I was active on the list and I wasn't, and trying to get even to a more modern way of doing that. So let's not send that stuff through the mail. Let's figure out how we can use, modern technology to notify patients when their status changes in a way that the information really is crossing the barrier from transplant center to patient, and the person can really understand that information and do something with it. This is all part of a larger effort to improve the transplant system. The modernization is one part. It's a really, really important part, but it's absolutely not the only thing that we're doing. And all of these efforts really feed into each other with the goal of creating a system that all of us can trust and that puts the people who rely on it first. Yeah, I think in terms of resources, I would probably direct listeners to two places. So one is to the NKF blog, where we frequently post about what we're working on from a policy and advocacy standpoint. Marlena helps us with those and does a fabulous job. We would be lost without them. And we work really hard to tie our updates to patient stories that can make the policy less abstract and technical and feel more material to the lives of patients and real people. I would also recommend signing up to get updates directly from the part of the government, so HRSA or the Health Resources and Services Administration, that is working to implement the modernization. Unlike a lot of notifications that we get from the government in different ways, these are not complex and they're very comprehensive, and they're really focused again on that day-to-day work of improving the system. And I find them to be a really, really helpful read, just to kind of see a list of this is what we did. This is why we think it matters to patients and families. And I would direct anybody who's interested in the milestones to follow those.
Perfect. Yeah, I love that. We will definitely be sure to put those in the show notes. So everyone listening, be sure to check that out. And thank you for shouting out the blog. You guys are phenomenal with all the work you do. And we're thrilled to be able to share that with more people. So we are getting close to the end of our discussion today, but before we get to my last question, is there anything else about OPTN that you wanted to share that I haven't asked you about today?
I might just say that the OPTN is full of some incredibly committed, passionate, smart people that represent all of these different great groups in our transplant system, OPOs and transplant centers and histocompatibility labs and patients and patient advocates and families. And I think what excites me is having a better system to support them, a better infrastructure to support them. So when Jullie sits on the patient affairs committee and has a really great idea, the system has the capability to turn that great idea into policy, and then the tools needed to really implement that policy so that it makes a difference. It achieves what it's supposed to achieve, and it makes a difference in the lives of patients. And I think sometimes, that infrastructure layer can be invisible to us because it's not that interesting. But ultimately, all systems need the architecture behind them so that they can be successful and efficient. And that's really what we're building here.
My last question for you both, Jullie, let's start with you. If you could give a message to those waiting for a kidney transplant about the future of transplantation, what would it be?
Well, that there is a lot of hope and a lot of I think when I attend transplant meetings or big groups of people that are getting together to talk about these problems, I see thousands of people, right, working to improve donation and transplantation. And they really believe in the work, and they really believe that transplantation can change people's lives and transform. You get to go back to your real life and go back to doing the things you want to be doing and feel more healthy. There is a lot of work to still do, but I'm so grateful and encouraged by all the dedicated people like Miriam and like you across the whole transplant and donation community who genuinely care about getting it right for patients. It brings a lot of hope and a lot of gratitude to just see so many people working on it. So I know it's going to go well. We just have to keep at it.
Yeah, I would echo all of that. I would just say there are so many reasons to be hopeful about the future, and I think to also, I think when you work on like public policy or like work with government policy, it's sometimes like I think change is messy, right? Like this is a big country serving a lot of different people. I think our government has a lot of different functions. Nothing is seamless as we hope that it's going to be, but I think change is a process, and we're in the process, and we're starting to see the fruits of that process. And there's just so much. There's so much to be hopeful for, and I think overall, we're just seeing so much attention to transplant. We're seeing, so many people, to Jullie's point, who really want to get it right. And I'm really inspired by that.
Yeah, I know all of the listeners today will take one thing away for sure, and that is both of your enthusiasm and hope for the future. And if everyone on the committee is a little bit like you, I know all of the patients are in really great hands. So, thank you both so much for coming on and sharing your expertise about this initiative. We really appreciate it.
Thank you for having us.
Yeah, thank you so much. This has been great.
Thank you both again. Listeners, be sure to check those show notes for any resources mentioned in today's episode. And until next time, we wish you all great health.
Thank you for listening. Do you have any questions? Email us directly with your comments and suggestions at nkfpodcasts@kidney.org. We hope you will join us next time. And from all of us at NKF, we wish you good health.